7 warning signs of a silent heart attack that are always ignored. In the event of a silent heart attack, the damage to the heart may not be detected by a medical professional until several weeks or months. This is where the term silent heart attack gets its meaning. Silent heart attacks can be difficult to detect because they often show no outward signs or symptoms. However, the damage is similar to that of a regular heart attack. The American Heart Association reports that out of an annual total of 805,000 heart attacks in the United States, an estimated 170,000 are silent heart attacks. There are warning signs your body sends you before a silent heart attack, and you should not ignore them. Let's talk about what those indicators might be. We'll also throw in some tips on how to reduce the risk of silent heart attacks and what to do if you think you're having one. But first, what is a silent heart attack? Most heart attack scenes in movies show the victim clutching their chest, gasping for air, or collapsing. The situation isn't always so dire, though. In contrast to how it is often shown in movies and TV shows, a silent heart attack usually has no visible signs at all. Experts label this condition as silent myocardial ischemia. It's hard to fathom how something as life-threatening as a heart attack can occur with no warning at all. A silent heart attack is just as dangerous as any other kind. Your heart can't pump unless it receives oxygenated blood. Plaque, made up of fat, cholesterol, and other substances, can block blood flow to the heart, resulting in serious or fatal consequences. The longer your heart goes without blood, the worse off it will get. Because silent heart attacks are frequently not immediately recognized, the damage they cause is often severe, and they can be fatal if not treated. Experts estimate that 45% of heart attacks occur without any symptoms at all. Women are much more likely than men to experience one. Due to the inconspicuous nature of silent heart attack symptoms, they are frequently misdiagnosed. Now, let's dive into the signs of a silent heart attack that is always ignored. 1. Cold sweats and nausea. Toxins in the body can be eliminated with the help of sweating. It's the body's way of cooling down after being subjected to strenuous activity or extreme heat and humidity. Sweating profusely, however, even when the temperature is reduced, calls for immediate attention. Waking up in a cold sweat, feeling nauseated, and vomiting are all symptoms of the flu, but they can also signal signs of a silent heart attack. An unusual amount of perspiration, especially when the individual is not physically active, may indicate cardiovascular problems. Because the heart has to work harder to pump blood through narrowed arteries, the affected person will sweat more to cool down. If you frequently break out in cold sweats, you should consult a doctor. Night sweats are a common symptom of heart problems in women. This symptom is often attributed to menopause, which can be confusing for women. However, if you wake up to wet sheets or find yourself sweating excessively throughout the night, this could be an indication of a heart attack, particularly in women. 2. Discomfort or pain in the chest. Heart attacks in general can cause severe pain suddenly, making them easy to identify and treat. But what about those times when it isn't? The majority of people who experience a heart attack report only mild pain or discomfort in the chest. Pressure, squeezing, or fullness could also be felt. These symptoms often develop gradually and come and go intermittently. It's not always clear what's causing these symptoms, and that can make diagnosis difficult. The best expert on your body is you. Over the course of a decade, 8% of diabetics in a study had a silent heart attack without realizing it, which illustrates that the risk is that high. You should see a doctor or go to the emergency room if you have any concerns about your health or feel extreme discomfort in your chest. 3. A stubborn flu. Usually, it takes about a week or two for the symptoms of the flu to go away completely. However, if you are still having difficulty breathing or flu-like symptoms after a long period of time, you should see a doctor. If you have a heart condition, you are more likely to become seriously ill if you catch the flu. Research shows that people with heart disease who also get the flu are nearly 10 times more likely to have a heart attack. When you get the flu, your immune system goes into full attack mode to destroy the virus. Inflammation caused by the body's response can increase blood pressure and strain the heart. In this condition, arterial plaque, a waxy, fatty substance, is more likely to rupture. Clots can form as the plaque deteriorates and breaks, blocking blood flow to the heart and increasing the risk of a heart attack. Research suggests that the risk of having a heart attack increases during and immediately after an acute inflammatory illness like the flu. Older people with heart conditions are more likely to experience this. 4. Pain in various parts of your body. The effects of a heart attack are not limited to the heart. Rather, they are felt all over the body. However, this can complicate the process of spotting a heart attack. Your left arm, back, neck, jaw, or stomach may hurt or feel uncomfortable. Individuals may experience a wide range of these signs. Some heart attack victims report feeling as though a rope was being tightened around their waists when they experienced severe back pain. You might also feel like you've strained a muscle or have a lot of pressure on your back. Whatever the case may be, you shouldn't dismiss these symptoms if you're worried about having a heart attack. 5. Weakness or fatigue. A silent heart attack is a possibility, but there may be other causes as well. This fatigue is very different from the kind you'd feel after putting in overtime at work or running an extra mile on the treadmill. Lightheadedness and trouble breathing have been linked to this sign as well. A heart attack can make you tired because your heart has to work harder to pump blood to your body when part of its blood supply is blocked. Feeling tired or exhausted for no apparent reason is a symptom that may indicate a more serious problem. Women are more likely than men to experience fatigue and shortness of breath months before a heart attack. That's why it's crucial to get medical help quickly if you start feeling unusual tiredness. Don't ignore these signs if you're experiencing them. Going to the hospital is your best option. 6. Shortness of breath. You may have heart failure if climbing a flight of stairs leaves you feeling as exhausted as if you had run a marathon. Shortness of breath, which may or may not come with chest pain, is one of the most typical signs of a silent heart attack. Although both sexes are susceptible, women are more likely to be affected than men. The efficiency with which your heart pumps blood is directly correlated with how well you breathe. The heart pumps oxygenated blood to the rest of the body. When the heart is unable to pump blood effectively, as it does during a heart attack, the patient may experience shortness of breath. When women experience unusual fatigue, shortness of breath may also be present. Some women say they experienced symptoms such as unusual fatigue and shortness of breath during physical activity. They might get winded after just a few flights of stairs. This symptom may be indicative of a heart attack in women. Get checked out if you're having trouble with everyday activities like making the bed or walking the dog, as this could be an early warning sign of a heart attack. 7. Lightheadedness. Women often say that they feel lightheaded and dizzy when they are having a heart attack. Some women say that if they try to stand up or do too much, they feel like they might pass out. This feeling is definitely not normal, and you should not ignore it if you have it. There is also the possibility that you will faint. What causes silent heart attacks? The same risk factors for a regular heart attack also increase the risk of a silent one. This occurs when a portion of the heart's muscle is injured or dies from a lack of oxygen. A blocked coronary artery is a common cause of this condition. The same risk factors for overt heart attacks also apply to silent ones. In most cases, the underlying cause of a fatal heart attack can be identified. Stress, high sodium fast food, or smoking are usually the causes. However, this is not always the situation. A number of factors, some of which are beyond your control, can cause a silent heart attack. Problems arise when there is a family history of heart disease or preeclampsia during pregnancy. The risk of having a heart attack also rises after menopause, particularly for women over the age of 55 and men over the age of 45. According to research in 2018, having a silent heart attack increases the risk of heart failure by 35% compared to people with no evidence of a heart attack. There is substantial evidence linking type 2 diabetes to an increased risk of silent heart attacks as well. In the United States alone, a heart attack strikes one person every 40 seconds. Your heart, however, is far more perceptive than you give it credit for. Before completely shutting down, it will alert your body. If you keep an eye out for these unusual signs, you might be able to avert a disaster. Preventative cardiac care may successfully keep you from having a silent heart attack. How can silent heart attacks be diagnosed? Standard diagnostic procedures for a heart attack typically include an electrocardiogram, a CT scan, and magnetic resonance imaging. Before and after a silent heart attack, blood tests can detect heart-related messengers sent to the bloodstream, which are called cardiac biomarkers. Stress tests and coronary angiograms can also aid in diagnosis. A group of cardiac specialists will be called in to help if you actually go into cardiac arrest. Aspirin or nitroglycerine, blood thinners, may be prescribed to ensure your heart receives a sufficient blood supply. They will keep an eye on how you are doing once the clots in your blood dissolve and your blood can carry more oxygen. If the blood vessels become too constricted, invasive surgical procedures like stenting, ballooning, or bypass surgeries may be considered. In the event of a silent heart attack, the victim may never even need medical attention. This does not mean that silent heart attacks should be taken lightly. Even if you think you've eliminated the world's leading cause of death, that false sense of security can backfire in devastating ways. It's impossible to generalize about how long a heart attack will last. Typically, it can last anywhere from 15 to 30 minutes. Beyond that, transformations become permanent. It has been linked to cardiac arrhythmia, a condition in which the heart beats irregularly. Other long-term effects also increase the possibility of having a stroke later in life. Participants who experienced a silent heart attack fared worse as the study progressed. About half of them passed away after 10 years, which is on par with the mortality rate among people who had a diagnosed heart attack. Experts stress the importance of teaching the public to recognize the less obvious signs of a heart attack. It's crucial that you get medical help as soon as possible. Reducing the risk of silent heart attacks. It is time to adopt a healthier way of life. You need to get moving. Start by taking a stroll around the neighborhood. You'll pick up the pace of your jogging in a day or two. Try out some yoga or meditation, along with some aerobics or even dancing, maybe even some resistance training. They will have beneficial effect on your cardiovascular health. Eat lots of high-fiber, nutrient-rich foods. The fiber in raw vegetables is great for your heart. Do your best to consume plenty of omega-3 rich foods on a regular basis. Avoid sweets and snacks if you don't need them. You can satisfy your sweet tooth by eating a piece of fruit, which will help you control your blood sugar levels. By controlling weight, blood glucose levels, cholesterol, and blood pressure, it is possible to prevent atherosclerotic plaque from hardening into blockages. Don't smoke either. Smoking tobacco reduces the amount of oxygenated blood that reaches vital organs, according to studies. Your goal is to increase the percentage of your blood that is oxygenated. Living with silent heart attacks. You are more likely to have another silent heart attack if you have already had one. This one is expected to be more serious and damaging. Modifying your lifestyle in healthy ways is something your doctor will probably suggest. This may include giving up tobacco, eating a heart-healthy diet, reducing stress and anxiety, staying active and fit, and lastly, managing your weight. A second heart attack could bring on different symptoms than the first. Call 911 immediately if you experience any new symptoms of a heart attack. Successful treatment of a heart attack must begin quickly. Now that we have learned about the dangers of silent heart attacks, let's discuss another topic that may be of interest. Did you know certain drinks can greatly benefit your health? Wondering what they are? Watch. Drink clove tea every day. See what happens to your body. Or watch. The longest living people drink this every day. Go ahead. Watch one. Or even better, watch both. Will you be more cautious with your heart from now on? Let us know in the comments below.